Hello, I am Sylvia Azania, and in this video, we are going to talk about how endometriosis affects a woman's fertility. We will discuss the decrease in the ovarian reserve and the oocyte quality, the anatomical changes affecting the fallopian tubes and the uterus, as well as diminished endometrial receptivity. And finally, we will also answer some of the most frequently asked questions that our users may have concerning this specific topic. Within the ovary, the endometrial implants and the resulting inflammation cause destruction of healthy tissue. This loss of healthy ovarian tissue impacts the ovarian reserve in women with endometriosis, potentially leading to a reduction. Alternatively, if a surgical procedure is carried out to eliminate these endometriotic implants located within the ovary, the ovarian endometriomas or chocolate cysts, the adjacent healthy tissue may also have been damaged, which would lead to an impact on ovarian reserve. Furthermore, when endometriosis is located in the ovary, an environment is created that is not conducive to the normal and proper development of follicles and the maturation of oocytes. This would be due to the presence of certain pro-inflammatory molecules and other factors that would have a toxic effect. Before continuing with the content of this article, I would like to ask you to please like it if you are enjoying it and subscribe to the channel if you haven't already done so, as this helps us greatly to continue and ensures that all the information we publish reaches more people. When endometriosis is present in the fallopian tubes, it interferes with the ovarian permeability. This condition makes the passage and transport of the egg through the tube impossible when it is released from the ovary. In the same way, the passage of the spermatozoa would also be impeded, which means that fertilization cannot occur. Furthermore, in addition to the permeability of the fallopian tubes, their capacity to capture the released oocyte may also be impaired due to the presence of pelvic adhesions caused by the presence of this endometrial tissue outside the uterus. As a direct result, the fimbriae of the fallopian tube cannot properly interact with the egg and capture it. Therefore, the egg cannot reach the fallopian tube after ovulation. In this way, if the egg does not reach the fallopian tube, then fertilization cannot occur. Furthermore, these adhesions caused by endometriosis can also alter the overall anatomy of the uterus, deforming it and even changing its contraction pattern. If these uterine contractions are somehow altered, it becomes difficult for the sperm to ascend to the fallopian tubes, where they must arrive so that the fertilization of the egg can take place. Female infertility that is attributed to endometriosis may also be caused by abnormalities within the endometrium itself, which is located in the uterine cavity. This affectation at the level of the uterine endometrium could reduce endometrial receptivity and therefore significantly hinder embryo implantation and the possibility of achieving a pregnancy. One of the main reasons could be that the integrin levels, cell adhesion molecules for proper implantation to occur, would be altered, as well as the presence of an inflammatory environment. And now we are going to answer some of the most frequently asked questions that our users may have in relation to this topic. Does endometriosis improve with pregnancy? Yes, that's right. Pregnancy offers a protective effect against the endometriosis. In a pregnancy, a woman's menstrual cycle stops completely. This change leads to slower growth of the endometriomas. Therefore, during pregnancy, the woman often feels relief from the symptoms and pain caused by endometriosis. However, everything restarts once the woman gives birth. Is endometriosis synonymous with infertility? No, endometriosis is one potential cause of infertility in women. However, this does not mean that all women with endometriosis will have fertility problems. It is estimated that between 30% and 50% of women diagnosed with endometriosis have problems when trying to conceive. The difficulty in achieving a pregnancy will fundamentally depend on the severity of the endometriosis and from the different areas affected by endometrial tissue presence. We would really like to know your experience, so I encourage you to tell us in the comments.